Mommy makeovers after pregnancy are more popular and prevalent than ever, and that term refers to the combination of cosmetic procedures to target areas like the breasts and the stomach. Mommy makeovers are not explicitly tracked as like a single statistics. We were looking into this, but the American Society of Plastic Surgeons tracks individual procedure numbers, and in 2024, nearly 200,000 tummy tucks were performed nationwide. That is the most ever. So to discuss plastic surgery trends in Denver, we're joined by plastic surgeon Dr. Samir Hasan, known as Dr. Beauty Blade. We're so glad to have you here and just kind of like pick your brain. And I want to start with the mommy makeover because it feels like they're all the rage. And you know I've had one. I know many women who have had them. Do you do them a lot in your practice?
Absolutely. It's probably the #1 procedure we perform here in Colorado, and folks who are done with pregnancy, done breastfeeding, even folks who are not necessarily having kids are coming in for what I call the body makeover. And it's typically the combination of a breast surgery and a body surgery, like a breast dog and a tummy tuck. I think it's a great way to rejuvenate the body and get your confidence and body back after you go through that major weight fluctuation, which women all do, even if they have 1 kid or 5 kids.
Yeah.
There's other benefits to it too, like restoring the abdominal wall and repairing the muscle separation that happens after pregnancy, which can be good for posture and even back pain.
Well, and I want to talk to you about like trends, because I remember like a few years ago, and you know, you can blame a lot on the Kardashians, but it was like everybody wanted the big booty and like BBLs. I'd never heard of a BBL before 2-3 years ago, and Brazilian butt lifts became all the rage. Are you still performing those? Is that still popular?
You know, absolutely. We're still doing BBLs, but we've seen patients get away from having the major drastic volume enhancement and using BBL as more of a gluteal, buttock, hip contouring. In our practice, I tell patients, it's what you want. If you've got the volume to give and you can have a BBL that's big like Kardashian or Cardi B, by all means go for it. As long as it's proportionate, I'm willing to do it. But most of our patients are having liposuction as part of a tummy tuck or a body contouring procedure. And I always ask the question, do you want to throw the fat away or do you want to use it? And most patients are opting to use it to shape out the hips, fill in the dips, or fill in the breasts if they're against implants. I think it's still a great procedure. I think it's definitely still relevant, but far more people are using it as a more conservative way to shape the hips.
Yeah. I would ask you about, you mentioned breast, right? And so I would imagine you still do a lot of like implant surgeries in Colorado, but I got my implants reduced, you know, a couple of months ago. And it was just great for me and, you know, my well-being, if you will. But the Expplant surgery, women removing their implants, my surgeon said that that's something she's doing almost as much, if not more, than implants right now.
Yeah, it's definitely something that's becoming more popular. Here's my take on it. I think a lot of colleagues would agree. Breast implants themselves, I believe, are safe. We're using it for folks getting cosmetic surgery, just looking for an enhancement. And also, we're using it in the breast reconstruction population for cancer patients. But there are patients who have underlying disorders, inflammation in the body, things like arthritis, lupus, that may not be best suited for breast implants. And then on the other side, there's folks who've had implants their whole lives, and they're just done with them. So we're seeing a fair amount of people come in to either downsize them, exchange them for fat if they've got it, or they just don't want anything in their body anymore. I mean, imagine if you're 65, 70, and really all you want to do is hike and run and bike and ski, and you've got large implants. You probably want to take them out at that point. So I think Explants are very commonly asked for, and if you have implants and you want to get them out and you're done with them, come on in.
It makes sense. You mentioned something, we were talking on the phone, preparing for this segment. You said you've been doing a lot of surgery with people who are awake. Please explain that to me, because I can't wrap my mind around that.
Yeah, people always ask about the awake surgery. So awake surgery is typically best for folks who are generally healthy. They don't have high anxiety. You got to be able to tolerate going to the dentist. And you have to be a certain weight in order for us to give you a certain amount of local anesthetic, lidocaine. This is the magic solution here. So folks who want small procedures, eyelid lifts, mini facelifts, even small breast lifts, and even awake BBLs can come in. They can take a narcotic and a Xanax, and then we inject this medicine, lidocaine, in large volumes of water. We wait about half an hour, and we're able to do most of these procedures for patients that are willing to do it and aren't anxious. So I always ask the question, how do you do with dental fillings? How do you do at the dentist?
Terrible.
Yeah, well, so for you, maybe I'll limit it and I'll say go to sleep. And I think anesthesia, it's still the way to go for certain things like mommy makeover and breast dogs. I give our patients the option. I think if you're comfortable, small procedures like eyelid lifts, facial things, lipo, the lunchtime procedures, if you will, they're a great way to have them done in the office under local anesthetic. You miss the downtime of anesthesia and you avoid all the side effects of anesthesia. Asthmatic patients are one example of folks who I think do great when they're awake because they don't have anesthesia, which can suppress lung function. Certain people will get nauseous, they'll vomit, they just don't do well under heavy narcotics. So I'm always giving patients the option as long as it's safe and they have the certain weight.
Thank you. Thank you for kind of like peeling the curtain back and letting us see a life in, a day in the life of a plastic surgeon. We don't have a lot of time. Just before you go, I'm curious, average age of your patient right now?
I would say mid-30s, early 40s.
Really?
That's kind of that time frame when people are done having kids, they're settled, they're weight stable. And I would say average gender is changing too. It used to be predominantly women, but the guys are coming in too.
They want to be snatched too.
Yeah, we need daddy makeovers too.
That's right. Dr. Hasan, Dr. Beauty Blade, we appreciate you. You can reach him on his Instagram, Dr. Beauty Blade.